All right, let's get right into a classic UKMLA scenario that you'll definitely want to have locked down: pediatric bronchiolitis.
Welcome to this clinical walkthrough on the bronchiolitis case for UKMLA, brought to you by Mediate, your 24/7 practice partner. Seriously, this is one of those bread and butter pediatric cases that comes up all the time in the exam. If you can nail the structure and the way you talk to the parent, you're already way ahead. So, let's break down exactly how you can do just that.
So, we're going to tackle this in 5 key stages. Think of it as a roadmap for the consultation. Following this structure, from the moment you say hello to the final safety netting, is exactly what the examiners want to see. It shows them you're safe, you're systematic, and you know what you're doing.
Okay, first up, the introduction and history taking. You know, that first minute or so is absolutely critical. You've got an anxious parent in front of you, and your job is to build that trust, that rapport, right from the get-go, while also starting to piece together what's going on.
Your opening doesn't need to be fancy. In fact, simple is best. Just introduce yourself clearly, check the child's details to make sure you've got the right person, and then hit them with a really open question. Something like, "What's been going on?" This is so important because it lets the parent tell you the story from their perspective. That's patient-centered care 101.
Now, to make sure you don't miss anything when you're digging into the main problem, a mnemonic like DUPARA is an absolute lifesaver. It just gives you a framework to follow so you can systematically cover all the bases of the child's breathing issues. So let's take a look at what you need to be asking.
Right, so when we talk about associated symptoms, this is where you really start to get the full picture. You've got to ask, are they feeding less? I mean, that is a massive clue about how sick a baby is. How are they sleeping? Are they more irritable than usual? And don't forget to ask about any similar episodes before. That little question can point you towards other things, like a viral-induced wheeze.
Okay, let's move on to thinking about differentials and risk factors. This is where you really get to show the examiner your clinical brain at work. It's not just about spotting bronchiolitis, it's about asking, what else could this be? And is there anything here that makes this particular child more vulnerable?
And the key here is to be efficient. You don't have time to do a deep dive into every single possibility. But with just a couple of sharp, targeted questions, you can quickly screen for the really serious stuff. Things like sepsis, pneumonia. You're basically ruling out the can't-miss diagnoses and showing the examiner that you're thinking about safety above all else.
And then, you've got to narrow your focus to the specific risk factors for this child. Were they born premature? Because that changes things. Are their immunizations up to date? And then you hit the big red flags. Are we seeing any dusky lips? Any scary pauses in their breathing? What we call apneic episodes. The answers you get here are going to directly feed into how you manage them.
Before you jump to the examination, please don't forget to ice the parent. Ideas, concerns, and expectations. Asking something as simple as, "What are you most worried about today?" shows so much empathy. It's not just about ticking a box for the exam, it's about connecting with the parent, and honestly, it's just good medicine. Okay, history done. You've got the story from the parent. Now it's time to put your hands on the patient. Well, gently, of course, and do a focused examination to see what clues the child's body is giving you.
So what are we looking for? These are the absolute classic signs. You'll see a fast respiratory rate, maybe their oxygen sats are a bit low. Look for that extra work of breathing. Are their nostrils flaring? Can you see the skin sucking in under their ribs? That's your subcostal recession. Then you listen to the chest, and you're probably going to hear that widespread wheeze and some fine crackles. And super important, check their hydration. Dry mouth, no tears, that's a big deal and helps you decide if they need to be admitted.
Okay, so you've gathered all your evidence. The story and the physical signs are all pointing in one direction. Now's the moment you deliver your provisional diagnosis. You need to say the word bronchiolitis clearly to the parent, but then immediately follow it up with a simple explanation. No medical jargon, just tell them what it is: a common chest infection for babies, what causes it, usually a virus, and why it makes it hard for them to breathe.
All right, this is arguably the most important part of the entire station, your management plan. This is where you bring it all home. You need to lay out a clear, step-by-step plan that's based on solid evidence. We're talking nice guidelines here to show how you're going to look after this child safely. Your plan has to be super clear and logical. Step 1, this child needs to be admitted to the children's ward, no question. Step 2, we're going to give supportive care. That means oxygen if their sats are low, and help with feeding, maybe with a little tube if they're just too breathless to drink. And then, and this is so important, you need to talk about the things you're not going to do.
And this right here is a massive communication hurdle you need to clear.
A lot of parents hear wheezing and immediately think asthma inhaler. It's a totally reasonable assumption, so you have to be ready to explain gently and clearly why we don't use them here. The secret is to explain that this wheeze isn't like an asthma wheeze. It's caused by inflammation and a bunch of mucus from the virus, and those asthma puffers just don't work on that.
Is the same story with antibiotics. You've got to explain why you're holding off. The reason is simple, right? Bronchiolitis is caused by a virus, and antibiotics are for bacteria. They just won't help. But, and this is the key to reassuring the parent, you need to tell them that you'll be watching their child like a hawk for any signs of a bacterial infection on top of this, and if that happens, you'll be on it straight away.
And hey, just a quick reminder, the best way to get comfortable with these conversations is to actually have them. You can practice this exact case right now and get objective feedback on mymediate.com.
Okay, we're on the home stretch now. Safety netting and closing the consultation. Look, your job isn't over when you've made the diagnosis and the plan. You have to make sure that when this family eventually goes home, the parent feels empowered and knows exactly what to do. Your safety netting advice has to be crystal clear. No vague if they seem worse stuff. You need to give them a concrete list of red flags. Tell them if you see blue lips, if their breathing stops for a few seconds, if they become really sleepy and you can't wake them up, you need to get help immediately. This isn't just good advice, it's a non-negotiable safety step. Here's a great tip for reducing a parent's anxiety. Manage their expectations. Laying out a simple timeline of the illness can be a game changer. Let them know that it starts like a cold, but it usually gets a bit worse around day 3 to 5 before it starts to get better. Just knowing that can be incredibly comforting for a worried parent. And just before you wrap up, give the parent a clear goal. Tell them, we'll keep your child here until they're breathing easily on their own and are feeding well again. This gives them something concrete to hold on to. Then, always offer a leaflet and, of course, ask that all-important question, do you have any other questions for me? It's the perfect way to finish a really solid, patient-focused consultation.
And there you have it. That's your roadmap to absolutely acing the bronchiolitis station. The key, honestly, is just practice. Run through the steps, say the phrases out loud until they feel natural and confident. And of course, you can practice this exact case now on mymediate.com.